Hey, how are you doing? Good. I'm glad to hear that. Thanks for coming in. I assume that you kind of got all the information in the email I sent you. Yeah, so I'm just going for another certificate here at Quake, and I need to fulfill some training hours, so I just reached out because I thought you might be interested. Okay, sounds good. Well, thank you so much for coming. I just have kind of a checklist of things that I need to go through and sort of prove I'm capable. So I'm kind of practicing for an exam that I'll take at the end. So some of the stuff that I have to do, I might have to do more than once or just a little bit differently than I would actually do it if I was checking you out for some sort of specific exam. But they'll all be things that are typical of a normal exam, just done a little differently. Does that make sense? Okay. I'll also be inputting some of the information, things that I see, just general medical notes into the computer as we go along to demonstrate my knowledge of all of the functioning parts of the body and just the different things that I'm actually testing for. Okay. And of course, if I do spot any issues along the way, I'll let you know. I'm not gonna neglect what I see. Okay. Cool. Well, it looks like to start, I'm going to use my stethoscope and I'm just going to listen to your heart rate. I'm going to listen on the front of your chest, on your belly, and on your back. Is that okay? Yeah. And we're just really casual today, so you can just sit, relax. You don't have to be on good posture or anything. What was I gonna say? Just make sure that when I ask you to breathe, you breathe. And when I'm doing your pulse, I'll have to get you to make sure your feet are uncrossed. But right now, you're fine. Okay. Alright, so I'm just gonna warm this up really quickly. I know it can be a shock when you get cold metal to your skin. Yeah, if you want, you can take your shirt off. If not, I can, when I get to the belly part, is the only part I really have to make contact with the skin to listen to your digestive noises. So I can just lift up the stomach area of your shirt at that point if you want. Whatever you're comfortable with. Okay. It's nice and warm now. So I'm just going to start here at your chest. And I'm just listening to your heart rate right now, so you can just breathe normally, whatever that means. Good. I'm just going to move the stethoscope a little lower. Good. Okay, and I'm going to move it to the other side now. Good. Heartbeat sounds really strong and healthy. I'm going to move it up now, kind of parallel to where it first was. Sounds really good. I'm going to do right in the center of your chest now, along your sternum. sounds really good. Have you been having any trouble with your heart at all? Any irregular heartbeats that you've noticed, or racing heart? Okay. You think that part's just situational kind of anxiety stuff? Okay. And nothing out of the ordinary? Do you do anything physical regularly? Like whether that's something for your job where you're loading and unloading, carrying things that are heavy, lifting things, or in your personal life if you exercise. That can be just walking, swimming, biking, playing with the kids. Okay. And in any of that time, do you ever feel like your heartbeat is sort of out of control or noticeable to you? Do you ever kind of stop and think like, uh-oh? Okay, good. Yeah, the heart is incredibly important, obviously, and paying attention to signs of poor heart health is also really important. But some of the things that present problems with heart disease and just general cardiac issues have to do more with like diet and exercise. So you won't always feel symptoms, which is kind of why they become so deadly and scary. But your heartbeat sounds really, really good. I'm not concerned at all. I know that you got your blood pressure taken here not too long ago, I think, and I'll check your file actually. Yeah, your blood pressure looks really, really good. So I'm not concerned. I just wanted to make sure from your end that there's nothing you've been experiencing out of the ordinary. No? Okay, good. Alright, I'm going to put my stethoscope back on now, and I'm going to listen on your back as well. Okay? Just going to come a little close. Okay. It's not too cold, right? Okay. And again, you can just breathe normally at the moment. Just listening on the upper portion of your back. Very good. I'm going to move down around your rib cage now. And to the lower back. Okay, great. And do the other side, same thing. I'm going to start at the top. Okay. Okay, sounds good. And moving to the rib. Okay, and onto the lower back now. Okay, that all sounds really good as well. At that point, not only am I listening to your heartbeat, but I also go near the ribs to listen to your respiration and make sure that you don't have any sort of sounds of fluid or like phlegmy sort of sounds. I know that's kind of gross, but there can be a rasping sort of quality when people breathe that can indicate some sort of virus or bacteria, any kind of infection that might be influencing the quality of the lungs. So And I forget, are you a smoker or do you vape or anything? Okay. Okay. Alright, so next we're going to do the belly. And as I mentioned, I'm just going to be listening for your general digestive sounds. I don't know if you've ever put your ear to someone else's tummy, but you can actually hear their digestion happening, and it's kind of actually pretty interesting. Yeah. So I'm just going to make sure that everything sounds pretty normal. It is normal to hear bubbling, gurgling, sort of liquidy sounds, all kinds of strange noises. It would be unusual to hear nothing, so I'm just making sure that digestion is happening in there. Have you eaten today? Was it recent? Okay, perfect. So I'm just gonna get right along your sort of belly button area here. Are you experiencing any pain or tenderness in your stomach right now? Okay, just let me know if I cause you any discomfort. I'm gonna try to be very gentle. I'm gonna go a little lower towards your pant line. Good. And now right below your belly button. Okay, and opposite side here. And just up a little. Doing great. I hear plenty of activity in there, which is good. That's what we want. I'm going to place the stethoscope now just kind of over towards your hip bone almost. Okay. Alright, and on the other side. Okay, good. That all sounds extremely normal to me. I hear good activity and nothing to be concerned about. You didn't feel any pain or tenderness, correct? Okay, just gotta double check. Okay. Next up, I just need to check your pulse. So if I can just get you to lay your arms out flat and just make sure that your legs are uncrossed. If you can put them down on the floor, just flat and kind of resting. And if you can sit somewhat up straight, it's best to have, if you cross your limbs or are slouching, it can affect your pulse rate actually. So making sure that there's a clear sort of pathway is the best way to get an accurate reading. Yeah, I learn something new every day, right? Okay, so I'm just gonna get my sleeve out of the way here. On your left side, okay, I'm just gonna put 2 fingers right here to your wrist. Good. And how are you feeling right now? Are you nervous at all? Pretty calm. Okay, good. Heart rate seems to be around a normal resting state. Let me get the other side as well. So here on the right, just the same thing. I'll use the same 2 fingers and press. Good. Okay. I'm counting the same beats per minute on both sides, around 68 or 70. And that is good news because it means we don't have any sort of obstruction on either side that is limiting the blood flow. Okay. Later on, I may have to check your pulse again. It's just, like I said, part of the practice, and also sometimes with certain types of patients you do have to monitor their pulse throughout the exam if they're at a risk of having some sort of chronic hypertension or problem with their heart rate for any reason. Also, sometimes during tests we sort of intentionally stimulate the heart rate and want to make sure that that is fluctuating appropriately to the given stimulus. So we're not doing anything like that now, but just for practice sake, I may check your pulse again, either in the wrists or the neck. Okay? Alright. So now what I'm going to do is kind of a thorough check over of your head and neck. Okay? And as we both know, there's a lot going around right now, so I'm gonna put on some gloves just to keep us both safe. I don't think you have cooties or anything, but I deal with patients all day long, and it's important just to make sure we're not spreading anything, me or you. Not to mention, who wants to be sick, you know? I've managed to avoid it so far this year. Have you? It really seems like everyone's kind of had some form. And it's the flu and that crazy virus is going around as well. Yeah, I'm not a fan. Okay, so now that we are sanitary, I'm going to start by examining just your face, okay? So I'm going to feel around the structure of your skull. I know it's kind of weird to think that there are bones under there. We focus so much on the outward appearance, right? Do you have any issues with your jaw that you know of presently? Is it ever tender or cracking, clicking, feeling strange in any way? Okay, can I get you to open? Good. And close. Okay, again, open. And close, okay. Does it hurt when I sort of do the circular movement here on your jawbone? No? Okay. I'm just going to press along the top now. Okay. That feels good. So you have a little bit of tenderness sometimes when you wake up. Do you know if you grind your teeth at night? You do? Okay. Have you tried using a mouth guard, or do you currently do anything for that? Okay. I would suggest, obviously you don't have to do this, it's not a formal appointment either, but just so you know, you can have a lot of tooth damage when you grind your teeth at night, and I know this from personal experience. They do have cheap mouth guards just at the drugstore. Typically you have to kind of boil some hot water and put them in there, and then you're able to kind of mold them to better fit your mouth. Yeah, the dentist makes ones that are custom, but they're usually pretty expensive. And if you're not experiencing a whole lot of pain, just one of the generic ones should protect your teeth. Yeah, it's just something to think about. Like I said, you don't have to, but I know that a lot of people do not like going to the dentist, and if you want to kind of avoid having, teeth that are cracking or losing their surface in the future, it can be just really a good preventative measure to use that mouth guard. An achy jaw and soreness in the mouth can be two pretty good indicators that you are clenching, grinding. A lot of people do this at night, but some people do it during the day too and don't realize because it's like a nervous tick or something. Yeah. Which is fine as long as it's controlled and taken care of before anything serious happens. Okay, that's totally fine. I'm gonna also feel now into your neck a bit. And I'm just gonna kind of roll my fingers along the bottom of your jaw and then work my way down. And I'm gonna especially feel your gland area. This is typically an area that will become pretty inflamed if you are getting ill. If you have a sore throat, a lot of the times your glands at your throat will be inflamed. It might be noticeably sticking out. Okay, I'm just going to press down along your trachea. And have my fingers around the outside as well, moving down here into the neckline. Any tenderness around your clavicle? No? Okay, good. And then what about your shoulders here? No pain, no tenderness? Okay, great. Let me see. Along with your thyroid gland, which is the one in the neck, I also kind of want to check your sinuses out a little bit. Okay, so I'm just going to take my fingers and press. You have a lot of different sinuses, and it's kind of like a really weird system, but I'm just going to press on the major ones in your face, and let me know if you feel any sensations, but especially if it's like a lot of pressure or kind of making your eyes want to water. Okay, so I'm going to press right here. How does that feel? Okay, can you take a deep breath in through your nose for me? Good. And again. Excellent. Okay. I'm going to use my thumbs now and get the ones above your eyebrows, okay? And I want you to tell me, pay attention to any sensations that this might have elsewhere in your head. A lot of the times, these are the sinuses that people get triggered with. Headaches, changes in the weather, and it can make for some pain in the back of the scalp or just radiating from that area. And if if you suffer from headaches or anything, that would be a good starting point if you feel any of that. Okay. So I'm just gonna press. Okay. And I'm gonna move a little bit further out. Okay. How did that feel? Yeah, it's common actually to feel a little bit of pressure down the nasal passage. Did you get that? Yes, okay. What about around to the back of your head or along your temples? Not really. Okay, good. That's excellent. I'm going to also now bring my arms around your neck, and I'm going to use my 2 fingers on both sides to press into a sort of pressure point you have in the back of your neck. Okay? And again, if you can just pay attention to the sensations in your scalp for me and along your head, and just let me know if you feel anything. Okay? Okay, so I'm just going to press. Does that feel okay? And where do you feel that? Back in the front of your face, okay? Is it kind of along this area? Okay, and up to the sides, kind of. Okay. Alright. How does your neck feel right now? Do you feel any tightness? Any tension? Okay, can I get you to nod yes and no for me? Or nod yes and then shake your head? No? Doesn't have to be drastic, but just to kind of release some of that tension. Okay. Do you notice that you kind of tense up your shoulders when you're feeling stress or maybe doing something for your job? Yeah, okay. Alright, so there's a chance that you might be experiencing some headaches or some head pain throughout the day due to sort of tension in your neck and the back of your scalp rather than your face and the front. Yeah, some people have either or some people get a mixture of both. So it's definitely good to just be mindful of that and try to kind of stretch your neck every day. Even if it's just for a couple minutes, it's worth sparing. And then just throughout your day, make sure you're reminding yourself to kind of bring your shoulders away from your ears and just loosen up that tension in any way that you can. Okay? Alright. Next I'm going to just check kind of around your eyes, okay? So I'm going to look at them first. Can you see all of my face right now? What about if you close one eye and the other? Okay, good. You can open them both. Have you been having any issues with your sight? New issues? No? Okay, good. Color looks good. Your irises seem to be pretty even and symmetrical. Pupils look normal. I'll check the dilation in a moment. And the whites of your eyes are also looking good. I see a tiny bit of a what we'd call bloodshot vein there on the right side, but it's nothing too drastic. Have you been getting enough sleep? I know it's hard too. Okay. Alright, well, no worries. I'm gonna use my fingers now and I'm just gonna touch slightly around the skin around your eyes. I know that's a very sensitive area, so I'll be very, very gentle. Okay? I'm just gonna give these tiny little tugs to the skin. Make sure that it is rebounding naturally, which it looks like it is. And if you'll close your eyes for me, I'm going to do the same on the lid. Okay. Good. That looks really good. I'm going to do at the corners and just pull. Okay, and then keep your eyes closed for me if you will. And I'm going to do up, pull up, and just make sure that you keep them closed, okay? They're tiny little movements, so it shouldn't be terrible. Okay, and keep them closed for me again, and I'm going to do the same on the bottom. Just pull down a little bit. Good. Your skin looks like it is doing just fine. No sagging or drooping. Everything goes back to where it should be after I move it. Did that feel tender at all? No? Okay, good. Alrighty. I'm just gonna check to your sort of muscle abilities with your eye. So sometimes I do this with the light portion, but since we're trying to stay nice and sanitary, I'm gonna do it now while I have my gloves on, okay? So if I can get you to, you don't have to go crazy, but kind of just squeeze your eyelids shut for me, and I'm gonna try to pull them open. You've probably done this before, and just don't let me open them, okay? Great. Okay. That was good. You can open your eyes if you'd like. Okay. Everything looks good on the face to me. I've kind of been just peering around as I've been doing this. Your skin looks even. I know we all get a little bit of texture sometimes, and that's completely natural. I don't see anything that is warranting any alarm. Eyebrows look good. Hair is growing in fine. Nose looks good. Have you been having any trouble with your breathing at all? What about your sense of smell? It's not the strongest. That's good. Okay, but you haven't been smelling anything off, like something that you know how it should smell and it smells differently to you, or maybe not having a scent to pick up on something that you used to be able to smell? No? Okay. Good. Okay. And can you breathe in easily through your nose with both nostrils? Okay. What if you cover one and breathe in? Okay, and the other side? Okay. It sounds like one side is slightly more open than the other, but that can be very, very natural for a lot of people. And then, of course, in those with a deviated septum, it can be almost impossible to breathe out of one side or the other. So as long as you feel like you're getting adequate airflow on both sides. Yeah, it didn't sound so drastic that I'm worried. Okay. Lastly, I'm going to use my little tongue depressor here. I'm not going to make your gag reflex known to the world. I'm just going to gently kind of press down on your tongue to examine it essentially. Make sure that the texture looks good, make sure that your teeth are looking okay, and there's no sort of sores or anything to be concerned about. Okay, so if you can just kind of okay. I'm gonna be really gentle and not go super deep, because I know that this can really bother some people, and you're here doing me a favor, so I'll be kind. I'm just gonna pull back your cheek here. Okay, and then I'm gonna do the same on the other side. Okay, and can you go and let me see the roof of your mouth? Alright, and we're gonna do one kind of a little bit further back, okay? Okay, good. No more of that, don't worry. Alright, that's everything I need the gloves for, so I'm just gonna take them off. Have you been having any issues with your sense of taste that you've noticed? Okay. Nothing tastes different than it used to. Okay. Alright, I've got quite a few notes to make, so if you'll just bear with me a moment, you can kind of relax for a second. Also, you'll probably be happy to know I didn't see anything that has me worried that you have any sort of flu or viral or bacterial symptoms, so it seems like you're in good health right now, which I hope it stays that way. Then we did neck. And just to double check, you said you did not feel anything with your sinuses here or here, but you did feel something with the pressure point in the back of the neck, correct? Okay. Okay, cool. Alright, next up we are gonna do the light test, okay? Nothing crazy, okay? First, I'm just gonna take a general look at your eyes again with the flashlight. Pupils look to be dilating or constricting in this matter, I guess. Okay. I'm just going to place my hand in the middle You may have done this before, so sorry if I'm repeating myself, but for the practice, I just want to say that I'm going to shine the flashlight into one eye at a time, and the goal is that your other people will also sort of react to the light even though it's not being directly affected. And this is called direct versus consensual dilation and constriction. Okay, so right now if I can get you to just close your eyes for a few seconds for me, and then when you open them, I just want to make sure. Okay, good. They reacted fine. So here we go. I'll look for the direct constriction. Great. And now I'm just going to peek over here and make sure it's also consensual. Great. And we're going to change the direct eye, okay? Starting on your right side now. Good, direct constriction. And I'm going to peek. And we have consensual restriction as well. That looks great. Okay, now I'm just gonna make sure that your eyes can focus from point to point. Okay? This can be a little bit more difficult when one of the points is a light because it sort of stuns your eyes momentarily, and sometimes people have a hard time refocusing their eyes, which can be a sign of a whole host of underlying medical conditions, everything from just astigmatism to diabetes. So I'm going to place the light and my finger in two different areas. And I'm gonna direct you to look at one and then look at the other, back and forth. I'm not really gonna try to trick you. I just want to see if you can find my finger from the light in an adequate amount of time. Does that make sense? Okay, good. So you can just stay looking at the middle of my face at the moment, my mouth, nose, or eyes, whatever makes you comfortable. And I'm gonna set up here. Can you see both the flashlight and my finger in your peripheral vision right now? Okay, good. So let me have you look at the light. And look at my finger. Look at the light, please. Good. And find my fingertip. Great. Look at the light again, please. And finger. Great. Look at the light. And look at my finger. Perfect. Okay. That looked really good. You seem to be able to find each point very quickly. So now I'm going to do the same thing on the other side, okay? So once again, if you could just look in the middle of my face while I set up. Great. And can you see the flashlight beam and my finger in your peripheral vision right now? Great, okay. And so can I get you to look at the light and find my fingertip? Look at the light again. Fingertip. Look at the light again. Finger. Good. And look at that light for me. Finger. Great. One more time, look at the light for me. And my fingertip. Great. That was excellent. now that we've done something that kind of had your mind working, I'm going to check your pulse again. Okay? So if you can just lay your wrists out for me like we did before, feet flat. Okay? I'm going to start on your left side and just press my fingers into your wrist. Okay, excellent. Just gonna feel one more round. Perfect. Okay, and the other side, the same thing, just relax. Great. One more round. Okay, excellent. Healthy resting heart rate again. Okay. So now I'm just gonna look at kind of the periphery of your eyes. I just looked at your pupils and checked out your irises at the same time and made sure that you can focus. So now I'm gonna have you look in some different directions for me, and I'm gonna shine the flashlight to check out sort of the rims of your eyes, if that makes sense. Okay, cool. So if I can first just have you look up for me. Good. And don't strain if it feels like tension around your eye. Only go as high as feels comfortable. Looking up still. Great. Okay. Now if I can get you to look down, not with your head, but just with your eyes. Okay. Good. Great. Okay. And if I can have you look to your right, please. Right side, right. And does that little bloodshot spot hurt at all? Didn't even know it was there. Okay. I'm just making sure. It's nothing to be alarmed about at all. Okay, can I get you to look to the left now? Yeah, sometimes when people get bloodshot eyes frequently, especially from computer work or lack of sleep, it can become really painful, and I have some drops, eye drops for that. So I just wanted to make sure you didn't need them. Great, okay. That all looks perfect. And then just do more things with the flashlight here. If I can get you to tilt your head back, I'm just gonna take a look up your nasal passages, okay? You can breathe normal. Okay, and just open your mouth for me. Doesn't have to be crazy, but just say ah so I can look in. Okay. Very good. Another thing that I have to do for this certificate is to be able to accurately measure the face, which sounds really weird, but we have a lot of cool like 3D mapping technology nowadays, both with printing for prosthetics, which is kind of a burgeoning field that I'm interested in, and also some of the machines that we take images on. Now you can sort of input more information about the topography of the person's face. Yeah, and it just helps to ensure over time in patients that might have a deteriorating condition that could affect the structure of their face. Also, some patients like to have their measurements in the event of an emergency. I know that sounds pretty harsh, but we do have some people who work sort of more dangerous jobs where they could have a potential accident that would compromise their facial structure. So, of course we don't want that to happen, but we do offer now that we can keep very rigorous face measurements in our database along with any other measurement, arms, fingers, whatever, so that in the event that something tragic did happen, we could use our 3D printing technology to create the most accurate prosthetic possible. Yeah, it's kind of easier than working with photographs and whatnot. So I've got my just measuring tape here, and it's I keep it tightly rolled, so it's always needs a little finessing. Okay. If I can find the right end, that would be cool. Sorry. Okay. So I'm just gonna take quite a few, but a few different measurements, and I'll try to do it accurately the first time. So I'm gonna measure across the width of your chin. And across your lip to the sides of your cheeks here. Another thing that's kind of cool about this is you can close your eyes if you want to. A lot of people don't know what their face shape is, whether it's round or heart or oval or whatever. And actually the way to kind of help yourself find out is you can measure if you can't visually really tell, kind of depending on where the widest part of your face is, that can help determine your face shape. And if you're kind of round all over, you probably got a round face. Okay. I'm going to do from the ear down your jawline here, right around to your chin. Okay. And on the other side, up to the ear. Okay, good. Measure down your neck. Good, stopping right around your clavicle again. Okay. And I'm going to do the base of your neck width as well. You're doing great. Thank you for being so patient. patient with me. Sorry I bumped you. Okay. Good. Alright, I'm going to go ear to ear now, but over kind of the top of your head. Good. And I'm going to do the same, but going under your chin now. Just going earlobe to earlobe. Okay. Alright, and now I need to do from the side of your nose to your ear. Okay, so I'll just put this here. Okay. And the other side. Oops, okay. Good. Okay, and I'm going to measure straight down your nose here. Okay. Just starting kind of at your scalp line there. Okay. Let me see if there's any others I need to get. To that, to that, to that. Okay. I think we are good on that. Just gonna save those real quick. Alright, we are down to our last exercise. Okay, so in this, all we're doing is testing your ability to hear. Okay, have you been having any issues with your ears? Have they been feeling clogged, stuffy, like they're draining, painful, tender? No? Okay, good. Good, good. Alright, so I'm just gonna whisper some random words into your ears, and it's up to you. This isn't a memory test, so if you want, you can repeat the word right after I say it. If not, you can hang on till the list is done and then repeat. Okay, it's up to you. So I'm just gonna lean into your ear. Okay. Can you hear me okay? Good. PlayStation. Toast. Popcorn. Daisy. Pupil. Canoe. Happy. Okay, good. Okay, you heard all this just fine. Okay, great. I'm gonna do the other side now. Can you hear me okay over here now as well? Okay. Telephone. Beak. Paisley. Candle. Glue. Box. Great job. We are going to do the same thing now, just with numbers. Okay? Alright. 2, 12, 24, 6, 16. Good. Okay. And on the other side. 4, 10, 96, 61, 5. Great. Okay. Well, we made it. You did an excellent job. I really, really appreciate your patience and dealing with me poking and prodding. Yeah, I know that you tend to feel a little bit of relaxation during these kinds of appointments, so I hope that this one was equally relaxing for you, even though it wasn't a formal exam. Good, I'm glad. Okay. Well, if we ever have anything like this again and you're interested, I'll definitely contact you. Yeah, okay. Alright, for now though, you are good to go, and it's still Quake Clinic, so if you want some time to yourself, if you want any snacks or water, other drinks from the mini fridge, if you want to lay down, whatever you feel like, you have all the rights that you typically do at one of your appointments here, so feel free to be comfortable, stay as long as you'd like, and I will see you at our next appointment. Okay, great.